Hello. Did you know that the eye drops you use, that remedy for hair growth, or even that harmless vitamin can harm your heart function? That's right. If you feel that something is wrong with the most crucial pump in your body, if you climb the stairs and feel disproportionately tired, have chest pain or discomfort, or even if people say you're wheezing, sometimes it could be the medication you're taking, and you might not even suspect it. Yes, some common medications, many of which you may have already taken, sold over the counter, can be toxic to your heart and put you at risk. And you thought that medicine was safe. You've always taken it, right? Well, that's the topic of today's video. What are the 10 common medications that can harm your heart or worsen the problem you already have? Some of them, if mixed, can even be deadly. Is the medication you, your spouse, or your parent is using on the list? Are you curious? Stay until the end because number 1 is the one that causes the most heart problems and is the most widely used. But before that, enjoy the video, subscribe to the channel so you won't miss our health tips, and like and activate the bell to receive notifications. Let's go! What are the common medications that can affect your heart? Medicine number 10, minoxidil. You've probably heard of minoxidil. When used topically or orally, it can stimulate hair growth, even used by men to develop beards. Initially intended for controlling blood pressure, it has proven effective for those with kidney problems and hypertension. However, it is crucial to consider how this medication can affect the heart. When applying minoxidil to the scalp to combat hair loss, an increase in heart rate was observed, reaching up to 20 beats above normal, and in more severe cases, it can cause chest pain in people with angina. For those with heart failure, minoxidil can lead to fluid retention, resulting in swelling, even in the face. If blood pressure is already low, it can decrease even further, requiring caution, as in rare cases, fluid accumulation around the heart, called pericardial effusion, may occur. Medicine number 9, antifungals. Whether for fungal infections in the nails, itching, or vaginal candidiasis, many people resort to antifungals available at pharmacies. However, it is essential to be cautious because antifungals like fluconazole or itraconazole can prolong the QT interval in the electrocardiogram, increasing the risk of severe ventricular arrhythmias. Individuals with pre-existing heart problems, especially heart failure, should be alert to symptoms such as shortness of breath, fatigue, and swelling. Medicine number 8, glaucoma eye drops. The treatment of glaucoma often involves eye drops, such as timolol. Although effective in reducing intraocular pressure, it is essential to consider its effects on the heart. Timolol can decrease heart rate and blood pressure, which, when combined with other cardiovascular medications, can result in heart block. Patients already using medications for arrhythmias or blood pressure, or those with heart problems, should consult their cardiologists before using eye drops. Medicine number 7, cold medications. When facing flu symptoms, such as a runny nose and cough, it is common to turn to cold medications. However, many of these medications contain decongestants that can raise blood pressure and heart rate. Moreover, the presence of caffeine in some can intensify these effects, making it essential to read labels carefully and consider safer alternatives for those with high blood pressure or other heart problems. These are just a few examples of common medications that can impact cardiovascular health. It is always advisable to discuss any concerns with your doctor before starting or stopping any medication. Medicine number 6, antidepressants. Widely prescribed to treat various conditions such as depression, anxiety, and obsessive-compulsive disorder, antidepressants can influence heart health in different ways. For example, amitriptyline, a tricyclic antidepressant, can increase the risk of arrhythmias and prolong the QT interval, potentially leading to heart problems. Antidepressants that act on noradrenaline, such as venlafaxine and desvenlafaxine, can also impact blood pressure and heart rate, requiring special attention in patients with a history of heart problems. Citalopram, another common antidepressant, is known to increase the QT interval, potentially resulting in dangerous heart rhythms. Patients using antidepressants should be aware of these possible side effects and inform their doctor of any signs of cardiac discomfort. Medicine number 5, antibiotics. Certain classes of antibiotics, such as macrolides, azithromycin, clarithromycin, and fluoroquinolones, ciprofloxacin, levofloxacin, can pose cardiovascular risks. Macrolides can prolong the QT interval in the electrocardiogram, leading to arrhythmias, while fluoroquinolones have been associated with problems in heart valves and complications such as aortic aneurysms. When prescribing or using these antibiotics, it is essential to consider the potential adverse effects on the heart. Medicine number 4, erectile dysfunction medications. Viagra, Cialis, and other erectile dysfunction medications have brought significant advances in the sexual lives of many people. However, in rare cases, conditions such as unstable angina or severe arrhythmias can complicate the use of these medications, increasing the risk of heart attacks or strokes. Patients experiencing chest pain after using these medications should seek immediate medical attention, as they may not be safe candidates for nitrates that dilate the heart arteries. Medicine number 3, Attention Deficit Hyperactivity Disorder (ADHD) medications. Methylphenidate, Ritalin, and Venvance are effective medications for controlling ADHD symptoms. However, as stimulants, they can increase blood pressure and worsen arrhythmias in people predisposed to heart problems. Studies also indicate that prolonged use of methylphenidate may increase the risk of cardiovascular disease in the long term. It is always crucial to weigh the risks and benefits of these medications in collaboration with a healthcare professional. Medicine number 2, Diabetes medications. Certain type 2 diabetes medications, such as thiazolidinediones, can lead to fluid retention, negatively impacting those already suffering from heart failure. Recent options, such as Jardiance and Forxiga, have shown to reduce the risk of death from heart failure, providing safer alternatives for diabetic patients concerned about heart health. Medicine number 1, the medication that most affects the heart is nonsteroidal anti-inflammatory drugs, NSAIDs. Here in the US, it is considered one of the most prescribed medications, with millions of prescriptions every month. Nonsteroidal anti-inflammatory drugs, NSAIDs, widely used to relieve pain and inflammation, including ibuprofen and diclofenac, can pose serious risks to the heart. The association of these medications with an increased risk of cardiovascular events, such as heart attacks and strokes, highlights the importance of considering safer alternatives, especially in patients with a history of heart disease. It is essential to be aware of the potential impacts of these medications on cardiovascular health. It is crucial to be well informed and talk to your doctor before taking any medication, especially if you already have a heart problem. I'm sure you're surprised by some of these medications on the list. And tell me in the comments, have you ever taken or are currently taking any of them? Do you have a heart problem? And from which part of the United States or the world are you? Write below and share this video with your friends and family. And if you liked this video, like it to help more people take care of their hearts before taking these medications, because on this channel, we learn to take care of our greatest asset, which is our health. I'm going to share 2 relevant recommendations here, which are appearing for you. And surely you will love our playlist about diabetes and our playlist about high blood pressure. Thank you very much for accompanying me until the end, and let's together promote the well-being of everyone. And until the next video.